Well, the pandemic has meant both positive and negative things for teenagers who are living with an eating disorder. A local doctor says there are many ways parents can help. Leah Lando has more.
So a lot of people think that eating disorders have to do with appearance, but that's not always the case, right?
Correct. A lot of times people with eating disorders feel that they are out of control, and controlling their intake gives them some sense of safety and control over one aspect of their life.
Dr. Nicole Seifra says stress from the pandemic has highlighted some of the things eating disorders thrive on.
So unpredictability, isolation, and feeling of lack of control are things that eating disorders thrive on. And those are the things that our entire population has been dealing with during this pandemic.
When it comes to recovery, people recovering and having more people at home during the pandemic, has that helped?
Absolutely. So we've seen, one of the things that we've seen as kind of a silver lining to the pandemic is people have been at home with families a lot. And especially for pediatric eating disorder treatments, the gold standard is family-based treatment, where parents are in charge of nutrition, support nutrition.
Let's go over the signs of an eating disorder. What should we look for?
Many of the signs are things like isolating, not wanting to participate in family meals or meals with friends, wearing clothing that isn't appropriate for the weather. So, wearing a lot of sweatshirts in a warm house. And also mood changes, such as being anxious or sad. Sometimes there is a comorbid anxiety or depression going on, but also being malnourished can amplify those symptoms of being anxious or sad.
People watching who are perhaps struggling with an eating disorder, what do you want them to know?
That help is out there and recovery is possible. One of the greatest joys about doing what I do is seeing patients and their families thrive after an eating disorder. We are really lucky to live in an area where there are quite a few resources that can help you through this, including the Western New York Comprehensive Care Service for Eating Disorders and the Healing Connection, as well as University of Rochester Adolescent Medicine, for which I am a part of.
She hopes those who need help will ask for it. Leah Lando, News 8.
And there are many local resources to help, including a program at Golisano Children's Hospital. For a link to that and more, head to rochesterfirst.com.